Come to the ovulation day, we know that we have good sperms that have already reached the track, and the minute the egg reaches there, we have healthy sperms waiting. Very importantly, women who have short cycles, which means that they have a 24-25 day cycle, may actually be most likely an easy tool where with accuracy you can actually see the follicle forming. Hi friends, my name is Dr. Shweta Goswami. You're watching Fertility Fridays, where we try and help you welcome hope into your family soon. So today we'll be talking about a very pertinent topic in fertility, which is ovulation tracking. How do I know when to try and am I doing it right? So see, overall we say that we have very big treatment options in fertility. We have IUI, we have IVF, we have surgeries, we have ICSI, all those big flashy terminologies. But honestly speaking, only 10 to 15% patients will need that. What we need is a genuine good attempt at tracking our ovulation. It can take anybody about a couple of months, about 6 to 12 months to conceive. However, what we should be very, very mindful of is that all the other tests seem okay. Plus the fact that we know when we are ovulating and we are able to try in that important window, which we call as the fertility window. So in brief, as we know, if we have a 28-29 day cycle, typically 14 days from that, which means if you subtract that, so around 12th to 16th day is when most women will ovulate. So we say it's very important to start planning at least 3-4 days prior to ovulation, because the sperms at least remain active inside the tract for about 3 days. Some people do this mistake. They keep waiting for the ovulation day to happen. That is also a very wrong strategy, because you might miss it completely and then miss the month completely. Plus the egg remains active for only 12 to 24 hours. So it's very important to know your fertility dates. Know that you start trying from say day 10 to day 11. Keep trying every other alternate day, like once in 48 hours. Every day is great, but once in 48 hours is a bare good minimum, which is good. So that by the time we come to the ovulation day, we know that we have good sperms that have already reached the tract. And the minute the egg reaches there, we have healthy sperms waiting. Also, of course, if we can track it very accurately, then those 2-3 days where we feel this is our fertile window is very important. So from time immemorial, people have always been tracking their ovulation. So there are very, very many natural ways of tracking. Of course, we all now in digital era have those apps which help us track, which means we put in our menstrual cycles, and an average of that gives the computer an idea as to what will be our fertile window. As I said, if you have very regular 28 to 30 day cycle, typically that would get into a day 10 to day 16 kind of a week where it is important to try. Very, very importantly, women who have short cycles, which means that they have a 24-25 day cycle, may actually be most likely be ovulating by day 10 or day 11 of their cycle. And therefore, it's very, very important, at least for those women, to start planning from day 6 or day 7 of their cycle, which means as soon as the cycle gets over. Because if you are a little late, you might have actually missed the cycle completely. And therefore, I think being mindful of our length of our menstrual cycle, not the time duration, but the frequency as to how frequent they come, is the most fundamental and simple way of trying to track our ovulation. Other than that, of course, we know that the symptoms that are there. So there is something known as Mittelschmerz, which means we call it ovulation pain. If we actually try and feel it and come to know about it, you would notice that around the day of your ovulation, you would have a very mild, not very painful, but a little nagging kind of a discomfort on one side of the abdomen. Women who can feel that can actually track their ovulation very well, because if you correspond that to an ultrasound, you would see that very accurately going with the timing of the ovulation. So if we are able to feel those symptoms of ovulation, that's great. Third, also, as we know that your cervical mucus tends to get very watery, and you suddenly have a very watery white discharge around the day of ovulation. I'm repeating, for all these symptoms, whether you get them or not, please start trying from your fertile window start, which is around day 10 to day 11. But in case you are able to notice these symptoms, you're having mild pain, you're having watery discharge, which is more than the usual days, then those are natural ways of telling you that you're ovulating. And if you're able to, try on the ovulation day, it's of course the most ideal to be able to be sure that we're at least getting the timing right. Once your discharge starts to become very thick and then you start to understand that your fertile window is actually crossed by, because there is progesterone that has already entered into the system. So the best time to try, therefore, from a natural perspective also, is when you start to have a little bit of watery and sticky discharge that you feel. The same thing can also be noted with very sensitive temperature thermometers, which is called the basal body temperature method. Of course, it's retrospective, which means till your body temperature is normal, you could be pre-ovulatory or ovulatory. The minute you've had a little rise in the temperature, which a sensitive thermometer will pick up, anything that goes towards a 99 or 99.5, then it's again is the sign that we are at a post-ovulation phase already. Now, these, as I said, are time immemorial strategies by which naturally, without visiting anybody, people are able to track their ovulation. Then the other simple things that come up is you have these ovulation kits that are available, over the counter from the chemist. And so you can take those kits. They again they tell you the LH surge. So if you understand the scientific part, once the follicle starts forming and once it's about 16 to 18 mm, the body has the LH surge happening. Now, once the LH surge happens, it takes about 30 to 50 hours for ovulation to happen. So the kit actually picks up that LH surge because the LH levels rise in the urine on that day. So you have to keep doing the urinary kit, starting from say day 10 to 11 of the cycle every day, preferably around 4 to 8 p.m. in the evening. And the day you see a second line is not the day of ovulation. Usually it's the next day, which is the ovulation day. So it's a very good tracker because it tells you you're right now in imminent ovulation, which means that day, the next day, and probably the next day are the best days to try. The problem with these kits and some of the other devices that I've seen is that they can be misleading, which means there are people who may have severe PCOS and may have very high LH levels and they'll always have the surge happening. So you'll have a kit coming positive, doesn't necessarily indicate ovulation. Second, you may not always catch the peak of the LH right, and therefore sometimes you just don't see the second line at all and you might already had an LH surge. So I personally feel that it should be done in conjunction with the other symptoms that you're seeing. But it is not a very good tool in isolation. Sometimes it gets frustrating because you don't even know if you're ovulating or not. Now, in countries like India, where ultrasonography is very easily available, their ultrasound comes up as a very simple and easy tool where with accuracy, you can actually see the follicle forming. You can actually know that, okay, this is your main fertile window because the follicle is now around 17, 18 mm in size. And I'm repeating, if you do not wait for ovulation to happen, you start trying the minute you're in that 2-3 day zone where the ovulation may happen. So ultrasound folliculometry is not so easily available or accessible outside in other developed countries, to my understanding, which is why the ovulation kits, etc., are very popular there. But I keep telling our Indian patients here that why should we rely on kits, when you have an ultrasound is a very simple tool available here. So I think it's a very, very much more objective way of doing it. We need not do it every month, but at least if we've done it once, we've understood and correlated our symptoms to the findings that you see in an ultrasound. That gives you a decent bit of confidence that you're having the ovulation right. Other than that, in terms of ovulation tests, we have a test called serum progesterone, which is usually done a week after your ovulation. So it's typically done around day 20, day 21. It's also just a basic test of ovulation, which means retrospectively tells you that, okay, whether you've ovulated or not. But these are more of medical tests that we do. I think as far as we are concerned, in short, to summarize, we have our, of course, cycle regularity, which gives us a lot of confidence to know which days we're ovulating. Confirming that on an ultrasound is very helpful. Looking at symptoms like mild ovulation pain, watery discharge are good things to do. Look out for basal body temperature measurement if we want to do, and ovulation kits. So I think if we at least do these, we would get a decent idea that if we have regular cycles, are we also sure that we are ovulating correctly, and what are our important days that we are trying for. Needless to say, in case you have cycles, coming more than beyond 37 days, 40, 45 days, or less than 22 days, then I think you need to consult a doctor because definitely there is some hormonal imbalance not letting ovulation happen right. So then just don't keep watching for these symptoms. You must see a doctor right away. So this would be my advice for you to, as I said, the simple, basic, fundamental way of trying for fertility, which we must do. We must be, very clear that the results of any such cycle is about 20-25%. That is the concept of monthly fecundability. So if everything else looks good, there are no other medical parameters to be concerned about. please at least try for a couple of months, at least 3 to 6 months. If all this doesn't seem to be working, you need to go on to the next level of at least doing fertility testing to confirm that everything is going all right. I hope this is helpful, and I hope it helps you conceive fast so that you don't even need to see a fertility specialist. But if you need to, of course, there's great technology at hand to help you out with that also. So thank you so much for your patient hearing. And if you have any questions, please feel free to write in the comment section below. I'll be more than happy to answer. If you can like and subscribe our channel, that'll be great. Thank you so much. So now I'll take some questions that have been posted by our listeners. So, Regila is saying, ma'am, I'm 50 years. Can I take IVF treatment? So, Regila, see, if as per the Indian law, once you've completed 50 years and if the husband has completed 55, then the IVF treatment may not be allowed. So, if you're nearing 50, yes, you can. If you've already completed 50 in India, you'd probably need to go to the court to get a special order regarding the same. As far as the medical aspect is concerned, yes, people can conceive even in the post-menopause era with IVF with egg donation. So I think you need to be clear about both the medical as well as the legal aspect of things. Then Pratibha is saying, as per recommendation of our doc, I've taken letrozole for 3 months, but I have one tubal blockage. What to do for conception? So Pratibha, see, letrozole is usually given either if you're not making eggs properly, so that's called ovulation induction, or to help you in super ovulation, which means we are trying to induce more number of eggs to increase the probability of conception. But in tubal blockage, the way it helps is it increases the probability that on the side which is okay, the right side, the left side, whichever side is open, the probability that at least an egg will form is why the letrozole is tried. However, if after a couple of months you feel despite all this strategy and despite with natural trial, if it's not working out, our bigger concern is that because tubal affection is bilateral, even if you have one tube blocked, the other tube also comes in a question mark for us, which means that, whether that tube is also working properly, is that properly open or not, is something that you must discuss with your doctor. Sometimes you might have to do some other tube test to confirm. It could just be a connual block, which is false. So it could be a false blockage, or it could be a blockage that needs to be opened up by laparoscopy. Or if both the tubes don't look very healthy, even the one that's open doesn't look very healthy on the HSG film, etc., then one might even also have to contemplate IVF. So I think we need to look at all those things in mind. Now, Honeyboo is saying, and that's a statement and I'll read it out. As a woman, I can only applaud women who go through so much to have babies such as IVF. It's not easy and it's emotionally, physically and mentally draining. It takes a toll on our body and mind. Hats off to us women. So, honey, I have absolutely no doubt in what you're saying. I think it takes tremendous amount of courage, tremendous amount of emotional resilience to go through a big procedure like an IVF. I think anybody who's going through it is looking at the final outcome and looking back at it and saying it's all worth it. So it's just like the normal delivery process. I think we as women go through amazing amount of pain to, deliver a child. But when the end product is so beautiful, you just completely tend to forget it. And that's the great part of nature. I think same goes for IVF. Women who conceive with it would probably just look back and think about it. But I have no doubt that it's an extremely a procedure where it takes a lot of gut and determination to go through it. So hats off to women completely, no doubt about that. So Safida is saying, ma'am, normal delivery try करने के लिए कितने चाहिए scar thickness? मेरी delivery date 1 week है, scar thickness 2.5 है. तो अगर ये previous cesarean के बाद देखिए, एक तो जो अल्ट्रासोनोलॉजिस्ट कर रहे हैं वो रेडियोलॉजी में कितना एक्यूरेसी है, क्योंकि क्लिनिकली भी देखा जाता है कि स्कार थिकनेस कितना है, बट टिपिकली अगर स्कार थिकनेस 5 mm से भी कम हो तो थोड़ा सा एक डर तो लगता है विजाइनल डिलीवरी ट्राई करने में, क्योंकि डर ये रहता है कि अभी तो सब कुछ ठीक है, यूट्रस पे एक बहुत पतली सी परत है जो स्कार है, बट अगर लेबर पेन्स के दौरान वो स्कार गलती से भी खुल गया तो बेबी को एकदम से ऑक्सीजन की कमी हो जाती है, मदर को एकदम से ब्लड लॉस हो जाता है. तो स्कार थिकनेस अगर लो है तो जो वी बैक होता है, मतलब विजाइनल बर्थ आफ्टर सिजेरियन सेक्शन, वो थोड़ा सा रिस्की तो हो जाता है. तो बट अपने डॉक्टर से क्लिनिकली उन्हें क्या लग रहा है वो जरूर डिस्कस करें. बट एक अच्छा स्कार थिकनेस होता है तो डेफिनेटली एक मन में कॉन्फिडेंस ज्यादा आता है. सो आई थैंक यू फॉर योर पेशेंट हियरिंग. यू हैव एनी क्वेश्चंस, प्लीज डेफिनेटली लेट अस नो or write in the comment section. Thank you.